Good evening. My name is Jamie Lara. In this session of HR management, we're going to be talking about concerns on high turnover rate. In today's agenda, so we're going to talk about a little background, why we're doing this today, why is it a problem, why is it a concern, why we need to address it, right? And data that we're going to see as tools to gather information, and also my plan for retention. So we're going to have a plan for retention of our employees. So a little bit of the background, right? At our Chicago small and private health clinic, we have experienced that our turnover has exceeded the industry norm by 10% for 2 years in all areas, including medical staff and administrative staff. Some of the problems that we need to further analyze are as follows. So some of the problems are employees are paid on a banded scale, and there hasn't been any offered of bonuses, profit sharing, so no incentives. On the exit interviews, some of the employees that were leaving shared some interesting information. So three of them were they saw no room for growth. So and that there was a harsh treatment from the administrative side, so administrative managers and doctors towards them, and some share that they have not received a paid increase for the last 5 years or more, and also they complain about a lack of communication and socializing amongst coworkers. Why should high turnover be a concern? So there's a few things that are concerning when we have high turnover. The problem of getting a new employee, right, to fill out a vacancy entails that the process of recruitment and the selection starts, which is time and money. It costs money and time. So it bringing in a person just that. It requires a new employee to be trained, which minimizes productivity. And if employee leaves the organization, right, then we have a problem because now we just lost our investment that we put in on recruiting and selecting this person. The patient and other stakeholders may bear a burden of handling inexperienced workers due to the loss of experienced employees who can mentor newcomers. So we lose experienced employees, good employees, and then we get stuck with newer ones who don't get the proper training, and as a result, they're inexperienced. A lower morale and negative culture may develop. Employees may hear from other colleagues who work somewhere who left the companies and left somewhere else doing better, and see how our clinic is not really doing much for them. So there's negative culture that's being developed, and low morale really stop caring for the place they work for. So gathering information, how do we gather some of our satisfaction, right? How do we figure out what is the main problem we have here with our employees and how can we fix it? Some data gathering proposals are so an employee satisfaction survey will be an important way to find out their perception of the workplace environment and the conditions they feel should be improved. Here are some of the followings to consider. So we have anonymous surveys, we have poll surveys, and feedback suggestion boxes. Anonymous surveys. An anonymous service which can be administered through emails or internal communication platforms such as the internet, right? The anonymity is a good because employees can reveal everything they feel. They can share all the information um, about their bosses, their managers, without any fear of any kind of retaliation or victimization. I want to keep in mind that non-anonymous surveys is also a good option for the clinic. It is good because it allows the employer to connect the specific problems to the given department and employees, which makes it easy to generate solutions. A culture of open and honest feedback can be cultivated at the clinic through non-anonymous surveys. But again, we need to get there first. And some people may be scared to share information or shy, and anonymous um, it's just a comfortable way to do it. Pulse surveys. So, unlike traditional annual surveys that are common in many organizations, much as the annual surveys are necessary, they hardly give the employee any chance to implement immediate chances of working um, in the working environment, right? So pulse surveys will entail shorter questions given more frequency, which investigates about their satisfaction levels and happiness while at work, amongst other things. The survey questions will have both open-ended and closed-ended questions to facilitate the collection of specific data and also give the respondents opportunity to express their problems on a particular organization matter. Feedback suggestion box, right? I think this is a really good idea. So the clinic will need to have a feedback suggestion box where the employee can continuously drop their feedback and suggestion at any time, even when it's not official time for surveys. Some employees who feel the surveys do not capture their problems can also give their feedback in this manner. So if it doesn't, if they feel like they're not being heard or whatever the survey is not working for them, they can also share it through these boxes. This can lead to feedback meetings where employees and their supervisors gather in an open forum for listening and constructive feedback will enable the clinic to identify the real problems facing their employees and respond appropriately. So my retention plan, right? So the retention plan entails a budget for the satisfaction surveys as well as numbers of proposals to address for the visible employee challenges. Some of the proposals are to really motivate our employees and to want to stay with us because we do care about them. The clinic will need to introduce all these benefits to make sure we have our employees happy. So one of them is a big one. It's a big concern, and is that a salary increase should happen every 2 years to cushion the employees from inflation and the ever rising cost of living. The pay should be based on experience level and the time they have served the clinic, so their time of service. Those that have been at the clinic for a long time will be considered for additional leadership roles to utilize their skills and encourage responsibility at the workplace. So there's a chance of growth. There is a reason I'm here, I'm going to be this, and I can aspire to be something else. A reward system will also be put in place based on the minimal days off, efficiency, and productivity, among other factors. The department leaders will need to do some kind of training for people management skills to reduce the hardness on their employees and ensure they are motivating and they're keeping a happy workplace. So we want to make sure that we give support to our managers so they can be leaders the way they should be. So we want to give the tools to everybody that needs them. The clinic will also include regular time off for the workers as they need to attend other present issues. So they may have personal issues, right? They need to take care of. So personal time off, um, perfect, right? Among other benefits, the company will consider introducing and including life insurance, tuition assistance, improved medical insurance for all employees. The clinic will also introduce team building and bonding sessions. They're going to be done according to the department and encourage socialization and foster empathy among the employees, right? So they can get to know each other and we can build a culture because that's important for an organization, especially growth. Budget distribution. So it's given a budget 120, right? Um, we have employee satisfaction surveys. We have nurse and assistant bonuses, reception bonuses, accounting, marketing, people in the department bonuses, nurses, administrative management bonuses, executive management team, doctors, promotions and standing employees and pay raises, training workshops for department heads in an employer work system, which equals the 120 additional given for this plan. I would like to take a moment to thank you guys for listening to me and considering my proposal. See you next time.